Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Small bowel obstruction. Introduction. The small bowel, also called the small intestine, helps your body digest food and liquid. Sometimes the flow of food, liquid, and gas through the small bowel can be blocked. This is called small bowel obstruction. Small bowel obstruction can cause cramping, nausea, vomiting, and constipation. If you have a small bowel obstruction, you will most likely need to be treated in a healthcare facility. This program explains small bowel obstruction. It talks about the symptoms and causes of the disorder. It also explains how small bowel obstruction is diagnosed and treated. The digestive tract. The digestive tract is made up of organs through which food and liquids pass. The small bowel is part of the digestive tract. Swallowed food goes through the esophagus, a tube that connects the throat to the stomach. Food is partially digested in the stomach. Digested food travels from the stomach to the small bowel or small intestine. The small bowel is the longest part of your digestive system. It is where most nutrients are digested and absorbed into the body. Muscles in the walls of the intestines push food through the digestive tract. This is known as peristalsis. Fibers and digested food finally reach the colon or the large intestine. The rest of the nutrients get absorbed and stools are formed in the colon. Stools are stored in the last part of the colon. This part of the colon is made up of the sigmoid colon and the rectum. Stool leaves the body through the anus. Symptoms. The most common symptom of small bowel obstruction is abdominal pain. This pain can be dull and mild, or it could feel like a sharp cramp. Small bowel obstruction can cause constipation. This means it can be hard to pass stools. You may not be able to have a bowel movement or pass gas. Small bowel obstruction can also cause a swollen abdomen, decreased appetite, diarrhea, nausea or vomiting. If you have symptoms of small bowel obstruction, contact your healthcare provider. If left untreated, small bowel obstruction can cause the tissue of the bowel to die. This can cause tears in the wall of the bowel. Tears can lead to a life-threatening infection in the abdomen. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Small bowel obstruction can happen when the bowel is blocked or when the muscles of the bowel do not work normally. A blockage in the small bowel can be caused by hernias. Hernias happen when the bowel bulges through a weakened abdominal wall. Adhesions, or tough, scarred areas of the abdomen and bowel. Tumors, or abnormal masses of tissue. A blockage of the small bowel can also happen if the bowel becomes twisted. Small bowel obstruction also can happen when the muscles of the small bowel do not contract. This can slow or stop the movement of food through the bowel. Bowel muscle problems can be caused by certain drugs such as antidepressants and pain medication, infections, surgery. Diagnosis. Your healthcare provider will ask you about any symptoms you may have. He or she will perform a physical exam and ask you about your medical history. Your healthcare provider may choose to take an X-ray of your abdomen. This can show gas or stool trapped in the small bowel by a blockage. Your healthcare provider may perform a CT scan if the X-ray does not lead to a diagnosis. Treatment. Small bowel obstruction is almost always treated in a healthcare facility. Specific treatment depends on what kind of obstruction you have. You will not be able to eat or drink while being treated for small bowel obstruction. You will be given fluids through an intravenous line or IV line. IV means that the fluids will be given through a vein. A tube called a catheter may be placed in your bladder to help drain urine. A nasogastric tube, or NG tube, will be inserted through your nose and into your stomach. An NG tube helps clear gas that may have built up because of the obstruction. If your small bowel is only partially blocked, you may not need further treatment. Your healthcare provider may recommend a liquid or low-fiber diet until the obstruction is cleared. You may need surgery to treat a complete obstruction. Surgery can remove a tumor or adhesion, repair a hernia, repair a twisted bowel. Sometimes an obstruction can be treated with a stent. A stent is a metal mesh device that is placed in the bowel. It opens a path that bypasses a blockage. This is only done if you are not otherwise healthy and if surgery is not an option. Problems with the bowel muscles often go away on their own. Your healthcare provider may give you medication to help with muscle contractions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The small bowel, also called the small intestine, helps your body digest food and liquid. Sometimes the flow of food, liquid, and gas through the small bowel can be blocked. This is called small bowel obstruction. The most common symptom of small bowel obstruction is abdominal pain. This pain can be dull and mild, or it could feel like a sharp cramp. Small bowel obstruction can cause constipation. This means it can be hard to pass stools. You may not be able to have a bowel movement or to pass gas. Small bowel obstruction can happen when the bowel is blocked or when the muscles of the bowel do not work normally. Small bowel obstruction is almost always treated in a healthcare facility. Specific treatment depends on what kind of obstruction you have. Thank you for using Explain.